Um, the date of encounter was July 17, 2023. Patient ID is already modified. Patient is a 53-year-old Ariana Doe, arrived in the clinic in the company of her husband with complaint of pain and lump in the left breast. Patient is a reliable historian, so every data was collected from her. The chief complaint was I have pain and lump on my left breast, HPI. A 53-year-old Hispanic female came to the clinic with her husband with complaint of painful lump on the left breast. That started about a month ago. Patient states she feels irregular lumps on her left breast, which is more painful on the outer upper corner of the left breast. She reported noticing the left upper breast area of worsening pain and size increase within the last 3 days. She claimed her pain to be 5 on a scale of 10 with an aching sensation. She stated she has been using over-the-counter Tylenol and alternating with ibuprofen to manage the pain. Patient revealed that her mother was diagnosed with breast cancer at the age of 56, and she's really concerned and worried about these symptoms. While the patient denied any symptoms of redness, increased warmth, swelling of left breast, fever or chills, swelling glands or nipple discharge, she mentioned a past surgical history of hysterectomy, which was indicated by irregular period and menorrhagia, past history, hypothyroidism, UTI, screening HPV test normal, pap smear normal, gravida 4, term 4, preterm 0, abortion 0, leaving 4, normal vaginal delivery without any complication. Allergies, no allergies, food, environmental, seasonal, allergies, none. Surgery, hysterectomy, medication, patient is taking levothyroxine 75 microgram POQ daily. Immunization, patient is up to date. Our last flu shot was August 22. Self examination of breast, yes. Social history, patient denied tobacco, cigarette use. She denied any use of drugs like cocaine, heroin, denied any use of alcohol. Occupation, patient work at post office at the front desk. She's married and live with her husband. Patient diet-wise, try to eat more vegetable or fruits. Exercise, she exercises once in a while. Family history, father, hypertension, hyperlipidemia, type 2 diabetes, mother, breast cancer, and hypertension. First sister, type 2 diabetes. Second sister, hypertension. Brother, type 2 diabetes. She has 4 kids with no past medical history. ROS, general, no changes in weight, weakness, fever, memory loss, skin free of rash, lumps, sore, itching, dryness, color changes, changes in the hair. Head, denies experiencing headache, concussion. Eyes, deny double vision or excessive tear, pain, corrective glasses. No changes in hearing. Nose, no running nose. Neck, no enlarged gland or goiter or stiffness in the neck. Neuro, patient deny headache, syncope. Respiratory, no shortness of breath, no wheezing, no cough or anything. Cardio, patient deny any chest pain or anything like that. GI, no changes in appetite. GU, no suprapubic pain or dysuria, urgency or frequency, and urination. Breast, patient said I have pain and lumps on my left breast, but my right breast is okay. Female, the last mammogram patient did was in 2021. Result indicated no mammographic evidence of malignancy. Physical assessment, temperature 98.4, heart rate 72, respiratory 16, BP 124/76, SpO2 99%, pain 5/10, weight 156, height 64 inches, BMI 26.85. Assessment, chest pain, no abnormality of chest wall, no chest pain or decrease or chest expansion. Is symmetrical, no deformity. Breast, no dimpling or skin changes. Breasts are heavy or pendulous and feel softer. The left breast, though, appear asymmetrical in comparison to the right one in terms of size and shape. The left breast is slightly larger than the other. Areola appears light pink to black with normal nipples noted. Multiple nodules were palpated with tenderness in the left breast superior lateral quadrants, and fluctual mass were felt. Painful lower lateral quadrants noted with fluctual mass. HEENT, here penile, no exudates, TM intact and purely gray. Nose, nasal mucosa pink and moist. And throat, oral mucosa pink and moist. Tongue mobile without lesion. Neck, no tender or cervical area, no lymph nodes palpable, no enlarged. Thyroid palpated. Neuro alert and oriented times 4. Respiratory chest wall appears symmetrical with equal expansion. No adventitious sound, no tear, no stridor, no crackles, bronchi, wheezing of nasal flaring. Cardio, creeps S1 and S2 without clicks or murmur, no gallops, flicks or rub, no extra heart sound. Abdomen flat, no tender, no distended. Differential diagnosis for this patient would be fibrocystic disease, breast lump, breast abscess, breast cancer, fibroadenomas, breast ectasia, or mastitis. Diagnostic tests that we recommended for this patient after the physical examination and assessment that's been done, mammogram or diagnostic mammography of both breasts were ordered for this patient. X-ray also was recommended. I talked to my preceptor, and he recommended that because of the multiple lumps and the thickening of the breast tissue that were noticed or also noticeable. So also ultrasound was ordered in order to distinguish between the lump, the solid lump, or any cystic lump that may be that was noted. When these tests come back, and if they prove negative, patient may be sent to see the OB/GYN doctor. Reason because aspiration of fine needle may be done to aspirate the fluid if you consider it to be cystic fibrosis or cystic fluid. And also a biopsy may be recommended later if needed. This will be done by the OB/GYN just to collect some biopsy. Formulation of the diagnosis is based on rationale that patient possesses all the traits of fibrocystic breast disease, and the disease-related progression is occurring with the patient. The left breast has several or multiple lumps, cyclical changes, get worse around period time, prominent lumps, dominant on the left side, sensitive and mobile. So the main diagnosis is fibrocystic breast disease with ICD code N60.19. So for the pain, I'll tell the patient to continue taking Tylenol, acetaminophen, along with ibuprofen, and to help with the pain, which patient has already been taking anyway. So if this come back, then also the patient can be treated with antibiotic if you think there's any infection when they come by, if there's any cyst in there. So all this will be done later when we wait for the result of the ultrasound and the mammography and also the X-ray. Thank you for listening. Thank you. I will share your comment.